This is Dr. Michael Tapper from Lenox Hill Hospital and the Northwell Hofstra School of Medicine in New York, reporting today on behalf of Infectious Disease Advisor from the Infectious Disease Society of America meeting, or ID Week, which is just getting underway in New Orleans. I'm joined now by Dr. Arjun Srinivasan from the Division of Healthcare Quality Promotion, or DHQP, at CDC, who is leading the division, the session here on epidemiology. And Arjun, I guess the first thing to ask you, I think I know the answer, is what is the hot news? What do you expect to be emphasized at this meeting?
Yeah, thanks, Mike. So great to be with you. Lots of exciting stuff in the field of healthcare epidemiology and also antibiotic stewardship. And I think some really exciting presentations in both of those areas. I think when we talk about infection control and infection prevention, there's going to be some really interesting data that's being presented on different ways that we are understanding the transmission of some of these pathogens in healthcare. Really interesting study by the group out of Duke leading a project for the CDC Prevention Epicenters, looking at the risk of contamination of surgical scrubs on nurses after an ICU shift. What was interesting is that they found in their study that about 20% of the time after an ICU shift, you can get bacteria that are genetically identical from the patient's room and the nurse's scrub. So certainly suggesting that there's a very high risk of getting contamination of your scrubs while you're taking care of patients. On the stewardship side, I think lots of exciting content on antibiotic stewardship. We definitely see that as an expanding portion of the ID Week meeting. One of the featured abstracts at the meeting is going to be a study done in Utah. And as you know, Mike, smaller hospitals, we are seeing them have a tougher time implementing antibiotic stewardship programs. And one of the challenges that they have is that many of them don't have an infectious disease specialist on staff. And so what this group did out of Intermountain Healthcare in Utah said, well, even if you don't have one on site, what if we give you access to some infectious diseases support, some stewardship support remotely? And they had 3 different groups, and the groups got increasing levels of support from a remote infectious disease and stewardship specialists. And what they found is that the group that got the most support had the biggest reductions in antibiotic use, and in particular broad spectrum antibiotic use.
So there's been some very exciting news or scary news that's made it into the press recently about device-related infections and some novel pathogens that we hadn't thought we had to deal with before. Any breaking news here about some of these issues, particularly thinking about the endoscope issue?
Yeah, there will be some stuff on some of the endoscope outbreaks, but I think the big one related to devices that's going to be presented here, again, is one of the plenary sessions, is about the contamination of the devices used in cardiac surgery, the heater-cooler units. And as you know, we have found that one of these units, one of these brands, is contaminated with an organism, Mycobacterium chimera, certainly not one that I don't think any of us in ID had much familiarity with.
Had heard of before.
Right, or had ever heard of before, and certainly didn't know how to treat. And these are very serious infections, pretty hard to diagnose. They onset many, many months, even years after the surgery has happened. So it's not front and center in the minds of the providers taking care of these patients. Mortality has been high. And I think it raises a lot of challenges that are both with respect to treatment, how do you best manage these infections? And so a lot of discussion here, because these are the folks who are best skilled at managing. Exactly. But also, what do we do with respect to prevention? These are oftentimes surgeries that need to happen. These are life-saving surgeries that need to happen. My understanding is that this is the most commonly used of these units. So
widespread,
how do we,
Europe and the United States.
Exactly right. So how do we balance the risks and the benefits, and what can be done in the meantime to mitigate the risk of those infections? So there's going to be an abstract being presented here at the meeting where several of the centers in the United States who've had this initial experience are going to talk about their experience, talk about clinically what they've been seeing, and also talk about the prevention side, what they've done.
I'm looking forward to it. It's going to be a great meeting. Thanks for joining us, Arjun.
Thank you so much, Mike.